Hey guys, Spencer here. I will be explaining to you the pathogenesis as to why bronchitis is classified as an obstructive disease. So let's just kind of just go with basics. Let's just talk about what an obstructive disease is. It's just caused by the narrowing of bronchi. Airways are collapsed, which would then prevent that airflow going in and out of the lungs, and then the lungs are also hyperinflated because they're not able to expel all that air. So that's probably why you'll see a lot of those patients that are barrel chested. Then there's many types of obstructive disease like bronchiectasis, asthma, bronchitis. There's just a lot of them out there, but we'll mainly be talking about bronchitis. So bronchitis, there's just a bunch of consolidation in the lungs, and then and also the bronchioles are inflamed due to the production of like just too much mucus, which would then cause that consolidation to go into the lungs. It can be acute or chronic. If it's acute, mainly it will last about 2-3 weeks. Typically, sometimes it could be less, sometimes it could be more. It just really depends on how bad it is. And then chronic is obviously just going to stick with it. So a lot of chronic mainly be like the COPD, emphysema, that kind of fun stuff. Can be caused by smoking, air pollutants, asthma. There's a lot of causes out there that can cause bronchitis. And then just some signs and symptoms would be shortness of breath, chest tightness, non-productive cough, hypoxemia, and then also can cause depression, anxiety. So shortness of breath can be caused by exhaling difficulty, just because of like the restricted airways. And then chest tightness would be just from that hyperinflation of all that inhaled air and not being able to expel that air. And then non-productive cough mainly will be noticeable with like some colored mucus. And then just during your examination, you'll see you can definitely like see this like patient would have pursed lips, and their lung. And then if you just do like a percussion or anything like that, you'll kind of notice more of a dullness more than anything. Normally if you like obviously, and then normally a decreased elastance in the lungs would be noticeable too. The IRV is reduced, FRC is increased, and then just there's just less time to breathe out air between like an expiration and your inhalation. So you'll be breathing out, and then probably like you're halfway through breathing out, you're gonna have to inhale right away because the patient's already out of breath. So just kind of give you an example. So let's say this right here is your normal lumen where your airflow goes in, and so it should be it should be nice and round, a nice opening, air to be able to flow through it in and out. And then let's say this one is bronchitis. You'll see it's a lot smaller, a little bit tougher to get air through there. So you can notice that the circle is smaller. I mean, due to that inflammation in there, it'll give more of a constricted appearance, which would cause that difficulty in breathing. So once again, this is just an explanation on the pathogenesis on why bronchitis is considered a obstructive disease. Thank you.